Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Francisco Torres. He's an interventional physiatrist. Today's Kevin MD article is A Doctor's Own Prostate Cancer Recovery. Francisco, welcome back to the show.
Thank you for having me, Kevin.
All right. So, for those who didn't read your Kevin MD article, just tell us a little bit about this most recent story and what the article's about.
Well, this article grew from a live experience, notes I wrote, conversations with my pelvic floor therapist, and reflection on decades of teaching about the recovery after a radical prostatectomy, which have to admit I was completely ignorant about the rehab of this condition.
All right. So, this happened just recently, this diagnosis of prostate cancer and, of course, the radical prostatectomy. Before talking about the rehab, just tell us a little bit about that experience and diagnosis and surgery from the prostate cancer.
Yes, I have already published two essays on your platform. I started with the one when I was diagnosed, which was a very interesting situation. First, how to handle the pre-op or before the biopsy, the options, the choices, and then after the biopsy, making the decision to have the surgery. So those essays talk about that, and then this one, the third one, was about recovery after the surgery, things that I had no idea that I needed to do.
So tell us the experience about what you went through, what was it like going through the surgery, and tell us about some of the things that you had to encounter after the surgery that you said that you didn't have much of an idea about.
Yeah, the thing was that I was focused on complication, selecting the right urologist to do the procedure. I was not aware that there are different, even in the robotic assisted surgery, there are different procedures or techniques that can limit the amount of complications. So I was more focused on that. And I totally forgot that the preparation for the surgery included training of those pelvic floor muscles. So I brushed them aside. After 2 months, I go back to the urologist and I have to publicly apologize that he came and said, "Are you doing your Kegel exercise?" And I said, "Hey, I'm a physiatrist. I know exercise. I'm an exercise enthusiast. I know my stuff." But then, after not improving, finally my wife convinced me to go and see a pelvic floor physical therapy specialist. And that blew me away.
Mm.
When she connected me to that biofeedback machine and I was finally able to discover my pelvic floor muscles, it was a life-changing experience. And before it was do your Kegels, but how do you even recognize if you're doing them correctly? Even with the biofeedback, I was still not able to recruit the muscles correctly. So that was my revelation there.
So after a radical prostatectomy, for those who aren't familiar with the procedure, tell us the type of complications you were experiencing.
Well, one of the complications is a week after, I told my doctor I'm very into exercise. I was just hungry of exercise. And so I was walking 10,000 steps even after the surgery, the first few days. And a week later, I start having this horrible, terrible back pain that was not responding to anything. Eventually, to make the story short, they found out I had an accumulation, like it was like a fistula in the pelvic region, and I have 1,000 mLs of fluid accumulated there. So they had to drain it. So that delayed the process of removing the Foley catheter, and I think that was part of the problem. I was not training my muscle during that time, so that was the major complication.
So you said that you had trouble with the Kegel exercises recruiting the pelvic floor muscle. So tell us a little bit about Kegel exercises for those who aren't familiar with them, and how did you know it affecting the muscles that needed to be
Well,
affected?
the data that we have is that if we do that training of the pelvic floor before the surgery and after, the complications and recovery time is very fast,
Mm.
and the data is very solid. The problem with the Kegel is that people tend to mention the Kegel. They were created by this doctor in 1948 in California. But at that time, when he did it with postpartum patients, he developed a tool for biofeedback to know that they were recruiting the muscles correctly. So in 1948, and then I don't know where we dropped the ball that we don't demand that to be part of the preparation before surgery. And I think that if we don't include that into the surgical consent form, I think we are probably classifying that we can be doing harm by not showing that to the patient. So that was my discovery. So I went back to my papers for pre-surgery and I found 2 pages of Kegel exercise describing them only. And
Mm.
obviously, like I said, even though I feel that I know the anatomy, I do my exercise, I know I'm a physiatrist, I had no clue how to activate those muscles. And even after going through physical therapy for almost a month and a half, I still compensate by activating my hips, my glutes, and I'm not able to isolate those pelvic floor muscles correctly. So I think that we need to emphasize that when that's why part of the book that I'm writing is that we should have a protocol that we measure with biofeedback the quality of those muscles before we do the surgery,
Hmm.
because it's okay to be free of the cancer, but I think we're neglecting the recovery and the restoration.
So when you went to this pelvic floor specialist and they did the biofeedback, exactly what did that entail, and what kind of special exercises or treatment did they incorporate to finally recruit the right muscles?
So I think it's when you visualize in the monitor how when you activate the pelvic floor, they put electrodes, recording electrodes around your anus, and that is the way that you can see the waveform. So it's very tricky because you try to compensate with the glutes and the hip muscle, and then you don't have the same strength of the curve. So that gives you feedback that every time you go and try to see if you're getting better, then you have a visual that you can tell, yes, I'm 20% better, 30% better. And then you decide if you want to use all the devices that they sell. I got one that you can sit on it. It vibrates when you're activating the muscle. So
Mm.
that helps you to retrain the pelvic floor muscles. And then that pelvic floor muscles are incredibly important for sexual health as well. There's a lot of studies done for just that. So that's another part of the surgery that affects you. And I think we have to normalize the conversation so we can talk to the patient openly about that.
How long did it take you working with the pelvic floor therapist to finally notice some improvement?
I think, to be honest with you, I felt some improvement. Like the first session, I could activate, I could feel a little bit more power in controlling it, but it's a slow process. And even,
Yeah.
the last time I went to check, I was only 20% now, even though I was doing my exercise for a whole month. So it's very tricky. It's not an easy muscle to recruit.
So you talked about prehabilitation or exercises before the surgery. So give us more detail. Exactly what do you mean by that? What kind of exercises? Are they just simply the Kegel? And what would you recommend patients now, or what would you have done now, knowing what you know now?
Well, knowing what I know now, I would have paid attention to the physical therapy 6 weeks before the
Mm,
surgery.
okay.
That would because these are elective surgeries. And then with a physical therapy that is specialized, because you can go, I have physical therapy in my facility, but they don't have biofeedback. They don't spend time recruiting those muscles. So you want to go to one that is specialized so you can do the biofeedback to have a baseline. And after that, they put a group of exercise beside the Kegel to strengthen your hip abductors, flexors, also your glutes, medius, maximus. So it's a combination that you do, and it probably takes you at least to go through that routine, at least 35 minutes to do that if you want to do it on a daily basis. I think just for me, it's awareness. One of the things that I do here with my pain management patient before I do an epidural, we do something, I try to train the patient to say, you need to proper nutrition.
Hmm.
You need to do this supplementation. So I kind of, and I can predict who's going to get better or not by just knowing if they put in the effort prior to the procedure. So I think that we need to continue to do this across the board, not just for prostate cancer. There was a recent study I was reading today about doing pre-habilitation before surgeries, any
Hmm.
surgery that is elective, and they found that the immune system goes up, and that was published just recently in this month in JAMA. Immunological system gets better, and also the cognitive function and the complication rate drops significantly.
So you saw a pelvic floor therapist after your surgery, but that's not standard of care, right? most patients who undergo a radical prostatectomy, they don't necessarily automatically see a pelvic floor specialist. Am I correct?
And you're absolutely correct. I think I again not include that part with knowing that the outcome of the recovery restoration improved 80%. I think it definitely you're doing harm by not allowing the patient to have that exposure or mandatory evaluation by a physical therapist. We're so precise about the surgical techniques.
Mm-hmm.
And and I have to give credit to my urologist. When I saw him, I said, hey, the PSA went to 0, the margins were free. I consider the surgery successful, but he said, no, you're still incontinent, you still have sexual dysfunction. So we're not there yet. So I think that's that mentality we should have.
So what more needs to be done? So should all urologists automatically send people to physical therapy or a pelvic floor therapist after a procedure like a prostatectomy?
I think that, yes, that's for sure, but I think that they should do it before because of
Mm.
all the data that we have reducing the complication and the recovery time completely being minimal, or, they improve significantly the recovery time.
Now, for other men who are diagnosed with prostate cancer, and as you know, this is a relatively common cancer, a lot of men do deal with prostate cancer. Just give us some other lessons that you've learned outside of what we're talking about today that you want to share with the other men who may have gone through your journey.
So this is a very interesting question. From the moment my PSA went up like 3 years ago, I refused to just do a blind biopsy because I thought that the results of a blind biopsy are very questionable. So I said, I'm going to follow with an MRI. So I had MRIs done 2 years in a row, which were negative until the third one came back positive with a dubious lesion. But then I decided, let me do the biopsy. And the biopsy was guided by that MRI and it was very precise. And it was definitely very localized, a Gleason 6. So the prognosis was excellent, I think, because I was on top of it, and people
Hmm.
don't understand that. They go, I have patients that they have gone for biopsy and it says negative biopsy, negative, and all of a sudden 3 years later they have cancer.
Hmm.
So I think that the standard of care should be guided biopsy with MRIs. That was something I learned. And then the second thing was after you have the diagnosis, they give you the options, but they don't explain to you what are the pros and cons. Like, for example, they told me you can wait, you can do radiation, you can do cryotherapy, you can do biopsy. But again, I didn't know. I was lucky. I had a friend that was an oncologist, and he guided me through the different options. And based on my age and what I do, yes, the surgery was the best thing for me.
So you had to rely on a friend to go over all the options. So, and you're a physician yourself. So
Yeah.
patients who aren't physicians and they're confronted with just a menu of prostate cancer treatment options. And like you said, it could be surgery, it could be watchful waiting, it could be brachytherapy, it could be radiotherapy. There's just so
Yeah.
many prostate cancer treatment options. How could we expect patients just to navigate something that is so life-changing?
I don't know because like you said, I'm a physician. I thought I knew it and I was completely lost. There's so many decisions you have to make. And then it's not only that, after you go through the surgery, you should be aware of the complication, like the incontinence and the level of that, because it affects your dignity. I wrote one essay, I mean, traveling to Italy on a pilgrimage with the diapers and the whole situation, it's pretty hard if you're vulnerable, you're gonna definitely you can collapse with trying to figure this out by yourself. And then the mistake I made, I was fighting my doctor because he was telling me to take medication, antimuscarinic, and I was fighting, oh no, those are side effects, and what you're doing is covering the symptoms. And I didn't understand the
Mhm.
value of retraining the bladder with those medications, even with the penile clamp. These are things that you fight because nobody tells you and you're afraid of asking. But then now that I realized it's for training the bladder, now I know. So I think we just have to have all that information available for the patient visually.
We're talking to Francisco Torres. He's an interventional physiatrist, and today's Kevin MD article is a doctor's own prostate cancer recovery. Francisco, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Well, my number one will be pertaining to prostate cancer surgery. You need to be sure that you are seen by a pelvic floor therapist that had biofeedback to measure your baseline, so you know that by training those muscles, the recovery time and complication are going to be less. That's for me critical, and you should continue with that program even after the surgery. And also, how soon do we start that? At least 7 or 10 days after they remove the Foley catheter. And so the sooner you get into that, the better.
Francisco, thank you so much for sharing your story, time, and insight. Thanks again for coming back on the show.
Thank you for having me again.